September is the awareness month for so many different causes and health conditions. Here's a list of what I've been able to find. Now, it does feel extra special to me to use this moment to spread some awareness and hopefully knowledge with you all.
But let me hit you with some knowledge.
To talk about a condition on that list called Chiari Malformation. Now, don't worry if you've never heard of it before, as it is considered rare, but Chiari Malformation happens when part of the brain extends down into the spinal cord. Basically, the skull is either too small or shaped in a way that presses on the brain, forcing part of it downward. Now, this isn't something you see every day. Again, it is considered rare, but since more people are getting MRIs and other scans, doctors are spotting it more often than before. There are actually three main types of Chiari. The type depends on how much brain tissue is pushed into the spinal canal and whether there are other brain or spine development issues. Now let's talk about symptoms, because this is where things can look very different from person to person. Some people with Chiari have no symptoms at all. They only find out they have it because they got a scan for something else. But for others, the symptoms can be very disruptive. Type 1 symptoms usually don't appear until late childhood or adulthood. The most common symptom is headache, often triggered by coughing, sneezing, or straining. Other symptoms can include neck pain, balance problems or unsteady walk, poor hand coordination, numbness or tingling in the hands or feet, dizziness, trouble swallowing, sometimes leading to gagging, choking, or vomiting, and changes in speech like hoarseness. Type 2 symptoms are usually more serious. This type almost always occurs with a birth defect called, and I can't pronounce it, but this is it right here, which is a form of this right here, where the backbone and spinal canal don't close properly before birth. Symptoms of type 2 can include breathing pattern changes, swallowing problems, quick downward eye movements, and weakness in arms. Type 3 symptoms are the most severe. In this type, parts of the brain like the cerebellum or brainstem actually extend through an opening in the skull. It's diagnosed at birth or even during pregnancy with ultrasound. Unfortunately, this type comes with major brain and nervous system issues, and it has a much higher risk of death. There's some evidence that Chiari malformation may run in families, suggesting a genetic link, but research on this is pretty early, so right now doctors can't say for sure whether or not it's hereditary. So when should someone seek medical help? If you or your child have any of the symptoms that I've talked about, especially headaches after coughing, sneezing, swallowing problems, or unexplained weakness, it's worth seeing a doctor. And finally, let's talk about treatment. Not everyone with Chiari malformation needs it. If there are no symptoms, doctors may just monitor with regular checkups. If symptoms do show up, treatment options can include medications to control things like pain, or surgery to relieve pressure and restore normal fluid flow. The exact approach depends on the type and how severe the symptoms are. So that's a general overview of Chiari malformation, what it is, the different types, the symptoms, and how it's treated.